These are the materials included in the kit. Wash or clean your hands and make sure they are dry before starting the test. Read the instruction for use carefully. Take out one extraction tube. Pull off the sealed aluminum foil on the extraction tube. Place extraction tube into tube stand or box tube stand. Unpack the swab. Caution: do not touch swab tip when handling the swab. Tilt your head back slightly. Insert the swab about 2 cm, at least with the entire soft swab tip, into the left nostril. Gently rotate the swab at least 5 times against the nasal wall. Insert the same swab about 2 cm, at least with the entire soft swab tip, into the right nostril. Again, gently rotate the swab at least 5 times against the nasal wall. Remove the swab from the second nostril. Caution: if the swab stick breaks during specimen collection, please use a new swab. Dip the soft swab tip into the liquid. Rotate the swab for at least 15 seconds while pressing the head against the inside of the tube to dissolve the specimen in the liquid. Remove the swab from the extraction tube by squeezing the sides of the tube together and pulling the swab out to ensure most of the buffer remains in the tube. Discard swab in biohazard specimen bag. Screw on and tighten the nozzle onto the extraction tube. The tube should be gently shaken by inverting it or by flicking the base for 30 seconds to mix the specimen to avoid the formation of foam or bubbles and the sample extraction buffer. Open the foil pouch and take out the test cassette. Place the test cassette on a flat, clean surface. Caution: perform the test within 60 minutes after the foil pouch is opened. Add 3 drops of the solution from the specimen collection tube to each sample well of the test cassette. Set timer for 15 minutes. Caution: do not read the result beforehand, even if a line has already appeared at control region C. The test results will be invalid if read after 20 minutes. Please dispose of the test materials in a biohazard specimen bag with the household refuse. If there are local regulations, please follow them. Wash hands thoroughly after test completion. 1. Positive result interpretation. Caution: the shade may vary, but if even a faint line appears, it should be considered positive. If you have a COVID-19 positive result, staying at home protects the people in your community, and you should not visit high-risk settings like hospitals and aged and disability care settings. If you feel unwell or need COVID-19 advice for someone in your care, talk with your health provider, or speak to a nurse by calling the Health Direct helpline on 1-800-022-222. If you develop symptoms such as severe shortness of breath or chest pain, call 000-000 immediately. Tell the call handler and the paramedics on arrival if you have COVID-19. If you have an influenza or RSV positive result, individuals are advised to consult a medical practitioner for follow-up clinical care. 2. Negative result interpretation. If you have symptoms like fever, cough and/or shortness of breath, please retest in 1 to 3 days. You must continue following the applicable hygiene and distancing rules even with a negative result. If symptoms persist or if unwell, please consult a medical practitioner for follow-up clinical care. 3. Invalid results interpretation. Review the test procedure and repeat the test with a new test cassette and a freshly collected sample. If the problem persists, discontinue using the test kit immediately and contact your sponsor. The sponsor contact number is 028328 1008 from Monday to Friday, 9 a.m. to 7 p.m. AEST, or 9 a.m. to 8 p.m. AEDT, or contact us by email address info@sonictec.com.au.